We're so pleased to have with us today Dr. Bradley Meyer of Okoboji Wellness Clinic, and you can check out Dr. Meyer's website, okobojiwellnessclinic.com. Dr. Meyer, looks like you got a little refresher there on the website just this week. It looks nice.
Yeah, Jeremy Pritchard does great work.
Yeah, it looks really good. And one of the things that we're going to talk about today, and we've hit on that before, is you have the opportunity with yourself and your staff to spend time with people, to learn their story.
Right. That's the driver. People want to be heard, so we give them a platform to be heard, and a big part on that visit then is discovery. When you have enough time to be heard, then you can start to dig through all the different toxin trauma exposures of a lifetime. And the client, our guest that comes in gives us clues. And so it's not only cathartic for them to kind of get some of this stuff off their chest, but and it's a blessing to have that time in our clinic to share with them and not feel rushed, because we typically have a visit, depending on who you're seeing in the clinic, anywhere from 30 to 90 minutes. Of course, for an acute visit for a bronchitis, that can be something 10 to 15 minutes. But, these things don't develop overnight. We develop these layers like an onion of different exposures to something like molds or heavy metals or, different bacteria or viral infections, Epstein-Barr virus that might be kind of latently sitting there all the time, making you chronically inflamed and tired. So we are so complex as human beings, it's impossible do you really think, how could we get to the root cause in a 7-minute visit? That is, typically how things are set up in a conventional setting. So that's one of the major blessings, not only for our guests that come in, is that they get to be heard, and we get the time to work with them on trying to find out the highest priority things that need to be taken care of first in their healthcare journey, to maybe help get them out of their system through a detox, or identifying what those triggers are and avoiding them. And so, that can be things like specific. I mentioned mold. If you are in an environment in a home it's older, and it very likely you can even have mold in a lot of the food that you eat. So, and then that gets into the brain, that causes neuroinflammation throughout the body, and then that leads to brain fog and fatigue. Other things that are extremely, so many things out there that put a stress on the body. We want to support the body to be able to handle those stressors. So spike protein being another one of them. And that's what we've seen throughout this COVID journey, the COVID-19 journey over the last 3 years, of what do we do with all of things related to COVID, the COVID recommended treatments that were done, the actual COVID infections. I had a gal that came in from northwest Iowa that over the last 2 years, it's been a horrible journey. She's been miserable. Her quality of life, she's in her early 20s, and she is battling, and this is all after COVID and multiple COVID bouts and some other things that happened that reduced her immunity as it relate to suggestions for COVID prevention. Specifically, she did get a couple of at least one of the injections, but so this introduces spike into the body. As far as we know right now, spike protein is another type of toxin that causes inflammation throughout the body. And so she, over the course of, again, the last 2 to 3 years, 2 specifically, these things all developed after this. She TIAs, where she's having like these mini strokes, and she developed this chronic right leg pain. The lateral aspect, the outside aspect of her right leg is chronically inflamed. She's not an athlete, and nobody could figure it out. MRI that area. Why is that IT band, that iliotibial band on her lateral leg, inflamed? She's not. It should not be inflamed. I think that was after that spike protein. And then she was having seizure-like activities, pericarditis, inflammation of the heart, chest pain with a seizure-like activities, couldn't find words. And so she had been through the gamut trying to find answers, and we sat down, several months ago, and she inquired about what we could do to work towards improvement in her care and her symptomology, and so we have taken this broad approach, but did start with the hyperbaric chamber. And she came in last week to share with me that since she has started, she's well over 15 to 20 treatments now. Literally, the pain has gone away. She was in agony at night, sitting up in a chair, could not sit in her chair at night because the pain was so bad. No more of these seizure-like activities where she couldn't find her words. No more of the chest pain. No more of these mini-type stroke things that she was experiencing. Again, she had a lot of the conventional evaluations. Her inflammatory factors were elevated. And finally, with the hyperbaric treatment, her inflammatory factors are now starting to come down as well. So just an incredible hope story that whatever the toxin trigger may be over the lifetime, because it's not just COVID. We get exposed to a lot in a day, and that stresses our body, and so she makes it all worth it, and the mission that we have.
Yeah, that's awesome. And we talked a little bit about that last week, and we have seen this. I mean, we're getting exposed to new numbers all the time, and the mental health challenges that people are having, young people having them at a very high rate. But I would imagine that the story you just told creates a mental health challenge for that patient. I mean, it's a real struggle. People, we talked about this last week. People want to live. They want to live their life. They want to go out and seize the day.
Right.
Instead of just survive.
Right. And just, this is when you think about our clinic, the Okoboji Wellness Clinic, think about the journey that you're on now, your health and wellness journey. Are you getting where you want to go as far as being on less medication or helping with some of these chronic aches and pains, these things that linger that diminish the quality of life? And again, I don't want to diminish the value of conventional medicine because it's a balance. It all works together. There's a time and a place. And I certainly still utilize a bunch of it. But when you come to the Okoboji Wellness Clinic, that's what we're going to be looking to do is to help you get on a path of recovery, of better quality of life, and we have, again, a lot of the tools in the tool belt, different modalities, different approaches from different types of medical providers. Our functional medicine team that literally will sit down with you for 90 minutes on an initial consultation to start that discovery, get to root cause, identify the biggest triggers that are making us continually sick, not feeling well, and then starting to peel the layers off that onion and make us feel better again.
Yeah, I believe what you are doing is, and you mentioned you certainly believe in what we would term normal type medicine, but the idea that you're a clinic where people run in to see you, you prescribe them a pill, and out the door they go, that's not what you do.
Well, it's a mixture.
Yes.
It's a mixture. So it's like, if you're coming in for an acute infection, for, let's say, a sinus infection, I want to talk to you about the fact that antibiotics can wipe out your gut biome, the good bacteria in your gut. And so we make a decision together. Sometimes there is a time and a place for an antibiotic, but I also want to talk to you about some more of natural remedies that may help you get over where you don't have to be on that antibiotic. So, yeah, you come in, I still can prescribe and will prescribe certain, pharmaceuticals, but my bend is to try to limit that as much as possible and get folks less dependent on as much medicine as possible. So.
Awesome. How do people find you?
712-339-6024 and OkobojiWellnessClinic.com. Call us. We have got appointments for hyperbaric consultations. What that involves is coming in to sit down with me or the team, and we can look at your complex medical history and look and say, yeah, I think this modality is a really good way to get you back on the wellness path. So that's one of many modalities, but it is a modality that's beautiful because it gets you feeling better for many people a little bit faster. Mm-hmm. And so as we work on this healthcare journey, which is a longer journey, peeling back the layers and trying to find triggers and toxins and how to make you well, in addition, a lot of times adding on that hyperbaric therapy is a game changer for people in their wellness journey, feeling better faster.
Very good. Doctor, thank you so much. Appreciate it as always.
Thanks, Dave.
Dr. Bradley Meyer, Okoboji Wellness Clinic. Find them at OkobojiWellnessClinic.com. Don't just survive. Feel better. Live the day.